now. We're having our health segment start right now. We have, of course, the Sabi doctor, Dr. Damien, in the building. Today's topic, pelvic inflammatory disease. Now, this is something, you know, over time has become more and more important to inform people about. Let's break down what it is.
Oh, okay. Very simply, pelvic inflammatory disease is an infection of the upper female genital tract, which includes the womb, that's the uterus, the fallopian tubes, the ovaries, and sometimes adjacent pelvic structures. Okay, that's the definition of it. In medical circles, sometimes we refer to it as an ascending infection, which means that, you know, it sometimes can start at the level of the lower genital tract, that's the vagina or the cervix, and ascend to establish in the womb, from where it can even ascend further to reach the tubes.
Okay, well, it feels like it's a long journey from starting from, you know, from the outside and then, of course, ascending all the way up there. But what are the risk factors and how exactly does this occur? So,
the risk factor, the major risk factor here is sexually transmitted infections, particularly chlamydia and gonorrhea. Okay. So we're looking at STIs. What are the risk factors that can predispose one to contracting STIs? Early age of, you know, first sexual activity. Okay, and we're looking at 18 years of age here. So women who, you know, have their first intercourse before age 18 are at a high risk of, you know, PID. Then being under 25 years of age and, you know, having been engaging in intercourse, that's also a risk factor. So there are two, you know, dimensions to it now. There is the factor of early onset of, you know, intercourse, and there is also the factor of being sexually active but under 25 years of age. Then, you know, having multiple partners, you know, partners that you engage in intercourse with, okay, that increases your risk of developing or contracting STIs, which puts you at risk of developing PID as well. I'm thinking now,
a lot of it has to do with sexual activity.
Yes.
Are there any other risk factors that do not have anything to do with sexual activity?
Yes. Okay. So, a very common one that we see around is IUD insertion, so intrauterine device insertion. And it's one of the reasons we go the extra mile to ensure that, you know, precautions are taken during the procedure to lower the risk of you know, infections. What we have seen over time is within the first 20 days following an IUD insertion, the risk of you know, PID increases by 6-fold. So we go all the way out to make sure that, you know, that doesn't happen.
So as a woman now, maybe in her 30s, maybe she's just got married, maybe she's noticing that it's not as easy as she thought to conceive. How would she be able to differentiate between it just being a waiting game and it being PID?
Okay, so the problem with PID, which makes it a bit challenging for us to catch very quickly, is that some women do not develop symptoms. Their symptoms are not very classical. Sometimes their symptoms even mirror, you know, other benign pelvic conditions. It could be ovulation. For example, now, they tend to have lower pelvic pain, lower abdominal pain. They might mistake that to maybe ovulation pain and not really see that as a problem. So they have the infection fester for a long period of time, during which by the time they are coming up, you know, to the hospitals, you know, scars have already formed, there's tubal blockage, and it becomes much more difficult. But let me just quickly list some of the symptoms. You know, lower abdominal pain, that is often chronic, all right? And this is the type that maybe if you're driving and you know, enter into a pothole, you know, that movement can cause pain as well. Oh, wow. You know, painful intercourse, all right? There may be bleeding during or after, you know, intercourse, okay? There may be, you know, some level of discharge that is noticed, all right? Often, you know, unpleasant, all right? With abnormal color, of course.
So in terms of color, not to be too graphic, what would be considered abnormal? Okay,
so, the color can take any, you know, any, how will I put it now? Any.
It could be any color.
It could be any color, but oftentimes it tends to be because of the pathogen causing it now.
Yeah.
Somewhat yellowish, you know, a dirty yellow, you know, with foul odor. Okay, that's
a sign.
Yeah, that's a sign. Okay. In fact, as a matter of fact, any discharge that is foul smelly, you know, that is not that the color is unusual, all right, should, you know, alert one to the possibility of an infection.
And of course, the first thing they're supposed to do is go get checked out. But
Absolutely.
what sort of tests would a woman need to take to be sure of what's happening?
Oh, okay, so the diagnosis of PID, pelvic inflammatory disease, I mean, it's twofold. There is where we look at clinical symptoms, and we also carry out laboratory investigations to, you know, tie one and two together to make sure that we arrive at, you know, the accurate diagnosis. So we look at symptoms, pelvic pain, you know, painful intercourse and the likes, fever sometimes. Then we also carry out investigations. We can carry out, you know, scan investigations, ultrasonography, you know, look out the dimensions of the womb and, you know.
So there's so many things that doctors are looking out for, but the key is make sure you go and see your doctor. And of course, I guess there's some prescriptions that will be put down for
Sadly,
you.
I mean, if scars have already formed, you know, we can treat the infection, but if scars have already formed, that can only be surgically corrected.